Schools are going to be testing for educational labels, whereas as clinicians, we're testing for clinical diagnoses. Those are two separate things. So there's certainly overlap there. We might both look at learning. We might both look at autism. The biggest things I would want for a parent to understand is that our testing is going to be significantly more in depth, almost always. So a lot of reports find their way across my desk. And every now and again, I will see an exceptional school-based evaluation, and I come back and tell the parent, there's nothing more to be done. Like they have covered their bases. We're good. No need for further testing. But that's 1% to 2% of the time. That's not saying those school reports aren't good. They're serving their function to determine whether an educational label is appropriate. But that doesn't get at whether there is a clinical diagnosis going on. So to my learning example from earlier, a school can tell you your child has a learning disorder in reading. They will never tell you it's dyslexia. They can't. They don't want to be on the hook for services for dyslexia until your child is 23. Same thing for ADHD. A lot of parents watching may have had the experience of sitting in a parent-teacher conference, hearing a teacher say a lot of things that sound like they're suggesting your child might have ADHD, but not coming out and saying it, which is confusing. They're not allowed to say that, nor can a school psychologist or a school counselor. They cannot make that diagnosis, and they may hint around at it. But if a parent isn't savvy to the reason the teacher's not coming out and saying it, they're going to potentially miss the boat on that.